Hi, my name is Gary.Head. I interviewed Jeffrey Young, who is the Director of Security and Safety at every McLaren Institute. There's multiple locations throughout the state. Mostly his responsibilities are just to maintain security. He works with cybersecurity, surveillance, increasing access codes so that nobody gets in any restricted areas, reviews incident reports. He coordinates with law enforcement and will conduct HR investigations if there is a case of any sort of malfeasance or any sort of incidents of workplace violence, workman's compensation, everything of that nature. I also interviewed Tyler Armstrong, who is an RN at the Flint location, and he contributed some information about the bloodborne pathogen protection policy that they have there. So with the nursing safety programs, McLaren only uses safety needles. They only use nitrile gloves. There's no latex allowed at all in any form, especially latex balloons are barred from any of the institutions. The bloodborne pathogen policy goes pretty in depth on education and prevention so that the nurses complete training programs and are equipped to deal with any sort of needle stick cases that may come up, although they are pretty rare. The color-coded gowns really help to differentiate what patients might be combative or experiencing any sort of inebriation or anything that might be a risk to the nurses or themselves, so that the nurses are more prepared to deal with these on a case-by-case basis. For the safety programs, I felt that the safety overall seemed very suitable towards the McLaren policies. Mr. Young was very adamant about signage to prevent any sort of slip and falls or to show workers their rights in regards to OSHA or the Joint Commission, so that there was no sort of safety issues going on there if they were educated on all those standards. The only real concern came about with the lift limit of the 35 pounds per nurse. Jeffrey Young, when I questioned him about this, if they were exceeding the limit in any sort of cases, he basically just said that they really encourage the use of machine lifts. Obviously, there's going to be some nurses that do more than they should, and there is a risk of injury, but I feel like this is kind of present at every hospital, and it's good that he did try to encourage the use of machine lifts and to use teamwork. It helps that they're not understaffed, and that they have multiple staff nurses able to lift a patient if they do need to. For the security, these are the metal detectors at the Flint location. They caught all this contraband and knives and weapons that shouldn't ever be in a hospital, obviously. That was all in 2021. Workplace violence, he said, has gone up. Mr. Young claims that the workplace violence has gotten a lot worse since the pandemic started. Patients are not nearly as nice as they used to be, and incidents have gone up quite a bit, almost double of that the year before the pandemic started. For the hazards, in nursing, there's a lot of HIV, HBV, HCV, bloodborne pathogen concern, which is mitigated, like Tyler said, with the programs to sort of teach about needle stick prevention injuries and the training that entails with that for the nurses. There's also patients can be very combative, as stated, with increased amounts of violence. Patients might need special care based on any sort of mental or inebriation basis that they could be experiencing, which could be harmful to the nurses. And then latex allergies are always a given for the nurses and the patients. There's both potential allergies that could be in place, but the 100% use of nitrile gloves really mitigates that risk. For the controls, there's a lot of prevention steps to control all of the potential hazards, like the color-coded gowns to kind of prepare nurses for what they're getting into with every case or every characteristic of each patient. The needle stick prevention with the safety needles really has cut down on the instances of needle sticks. Jeffrey Young claims that there's basically none at this point. They're really effective at stopping those. There's no latex allowed, even latex balloons. They're completely barred from every institution. Those machine lifts really help to prevent strain with the nurses and the teamwork of the multiple staff. They have a really good staff to patient ratio so that nobody's overworked or overspent on too many rooms. So then we have the missing controls. I feel like McLaren was really effective. The only real concern was that lift limit, but besides that, I felt that the Joint Commission wasn't doing enough to specify like any sort of specific guidelines. It was pretty broad, like when they said there's a well-written plan for providing a safe environment. That's kind of a broad term. What specifically deems an environment to be safe? I basically just have some qualms with the guidelines and standards rather than McLaren itself. I felt like McLaren's providing pretty effective, safe care to the patients and the nurses. And then the patient hazards, the potential risks might include latex allergies, medical errors, or outbursts of violence, but they use de-escalation techniques and work with law enforcement to kind of curb the violence. The nitrile gloves really help to eliminate that risk of latex allergy. And then there shouldn't be any medical errors, or at least far less medical errors if there's increased staff and they get to see every patient and provide quality care to all these patients, and they're not being overworked or straining themselves physically. For the OSHA standards, staff must be trained to use all the lifts, and they should be prioritizing those lifts rather than physically picking somebody up themselves or transporting them. Training has to be repeated with these lifts over time. The equipment's always being checked and monitored and maintained. And then safe patient handling should always be the primary focus. And then with the Joint Commission standards, basically Jeffrey Young shared with me one of the chapters, the environment of care for the Joint Commission, and it seemed to focus primarily on infrastructure, not necessarily with the nurses.